Hello people, welcome back. If you didn't see the first video, I'm here trying to put my 10 years of suffering with chronic undiagnosable pain to good use by sharing my experiences and also documenting my journey and trying to find a solution before I press the big irreversible button on amputating my feet. So for this one, I'm going to talk a bit about my backstory, what my condition is, what some of the operations and procedures I've had are, what the thought process behind them were, what led me there, and what my options are going forward really. So to go right back to the beginning, when I was 11 I had a biking accident and broke my skull. Never really thought this was relevant, but I'll come back to that in a little bit. 6 months later I got this pretty common issue that growing teens get. It's called Osgood-Schlatters and it's pain in the knees. What that is essentially an issue where you grow too quickly and your growth plate where the patella attaches to your shin gets irritated and it gets susceptible to injury. Most kids usually grow out of it in a couple of weeks or months, and that's what the doctors told me at 11. Just keep playing your sports, it'll go away. No surprises here, but it did not go away. As a kid, I played pretty much every sport there was, so I carried on playing for about 2 years and it just kept getting worse and worse and worse. So it got to the point where the physios and the doctors said, well, it's really quite irritated now, quite severely injured. You're going to need to take about 3 months clean off any activity really. Just to give it time to heal. So I did that, didn't work. It took 2 years of just complete rest for that to heal. And hindsight is a wonderful thing, but just resting is always only one part of a solution to an injury. It's definitely not the best way to go about it. But again, that happened years ago now, so not much I can do about it now. The relevance of this is that the chiropractor I've been working with lately is part of the functional medicine program. She's found the link in studies between concussion and the potential subsequent brain damage as a result of breaking my skull, Osgood-Schlatters disease, and unexplained lower limb pain. This is because the injury to the brain and the knee essentially breaks proprioception. For anything below the knee, that is. The brain therefore struggles to determine the status of anything below the knee and then kind of has a propensity to throw that pain signal when it's not needed. Then on the 1st of August 2013, I was playing football, got an injury to the top of my right foot. I went to kick a ball, someone else came in with the studs up, damaged some tendons and ligaments in the top of my right foot, which took about 6 weeks to heal, but they healed fine. When I went back out to run, I just got this pain. At first it was only when I was running, then it got quite significant when I was running, and after maybe 3 or 4 runs back, I would stop and have to walk back because it kind of got so bad. Over the course of the first year of it though, it kept getting worse and worse and worse, to the point that I'm at now where it would happen just when I'm standing, just when I'm walking. So it went from initially what I thought was a sports-based injury to just this condition that would happen whenever I stood up. Weirdly, even though it was just an injury to the top of my right foot when I played football, it was both feet that started hurting at the exact same time in terms of my heel pain. Where the pain is, it's literally on the centre of my heels. I will maybe show you later. I'll show you a couple of the scars that I've got from the operation so you can see where they were performed. So if you don't like scars and you don't like ankles, then don't watch that bit, maybe skip forward on that bit. So let's say this is the bottom of your heel, these are your toes. The pain is pretty much in the centre of the heel whenever I stand up, whenever I weight bear. It took me a long time to figure out that it's also the back and the sides of the heel bone. And I only didn't find this out for a while because I would stand up and it would hurt. That's where it would hurt. I wouldn't rest my foot up on, let's say, a hard coffee table. So it took me a while for me to actually do that, put some pressure on different parts of my calcaneus bone, and then figure out, wait, it's not just under the heel. It's actually the heel bone itself, whether that's either side or the back or whatever. So because it was a sports-based injury, because I used to run a lot, because I used to have high arches, the physios, the doctors, they all thought it was plantar fasciitis, which is a really common running injury, should get better. Because it kept getting worse and worse, we all were kind of week by week thinking, yeah, this isn't plantar fasciitis. In the meantime, I did all the conservative treatments for plantar fasciitis. It started off pretty strong that we thought that was it because I used to run and because I had heel pain. It kind of went hand in hand with the fact that I had high arches, so apparently my running gait wasn't quite perfect, which I believe. So I did all the conservative things like insoles, physio, chiropractors, osteopaths, massage, acupuncture, dry needling, injection, steroid injections, shockwave therapy. There are quite a lot of other things that it's been so long now that I can't even remember what they were. For about 2 years I'd do these conservative treatments. I would go from orthopedic to orthopedic, and every single one of them would say, well, you used to run and you've got heel pain, so it's got to be plantar fasciitis. And they would kind of ignore the bit that I said about the rest of the bone, because the plantar fascia is a band of tissue under the foot. There are lots of signs that you would get with plantar fasciitis. You'd probably have inflammation on a scan. You typically get pain the most when you stand up first thing in the morning, because that fibrous band of tissue gets really tight overnight. I didn't have any of those things. It was quite a lazy diagnosis for them to keep saying, well, you used to run and you've now got heel pain, so it's got to be that. Well, it's not. So the first doctor that I ever saw that presented something actually different and useful, he said, I think it's tarsal tunnel syndrome. Similar to carpal tunnel in the wrist, but there's a little strip down the back of your ankle, down the back of the medial malleolus, where 3 nerves run: your lateral plantar nerve, your medial plantar nerve, and your calcaneal nerve. These 3 nerves run down the side of your ankle, or the back side of your ankle, between the medial malleolus, which is part of your ankle, and the flexor retinaculum, which is, I don't know whether a sheath is the right word, essentially a layer that encapsulates them. They keep them nice and tucked in. If anything can kind of get in the way of that, it can put a lot of pressure on these nerves that run down into your foot. Theoretically, it can cause heel pain. Some of the causes for damage or impingement at the tarsal tunnel would be flat feet, which makes you pronate, or essentially your foot come in as you walk, which is the opposite of my issue. Mine's usually supination, but when you pronate, you can put a lot of pressure on those nerves that run down the side of your ankle. Excuse my hand gestures. You can have an injury to it, like a sprain or a fracture, that again puts pressure or damage to the nerves. You can have irregular growths, like you can have cysts, tumours, stuff like that. I didn't really have any of them. What I did have was a positive Tinel sign. So you tap on the tarsal tunnel. I'm just going to show you where the tarsal tunnel is. 1 second. Okay, so you can look away now if you don't like feet or scars or anything like that. So this is the tarsal tunnel, the bit that runs down the side of your ankle, and essentially a Tinel sign is when you tap here and those irritated nerves then shoot that message of pain down into your foot. I did have an EMG, or a nerve conduction study, on these nerves, and they didn't show any entrapment. However, the surgeon was adamant that, well, I've tapped on that bit, it causes some pain, that is the cause of your pain, they are entrapped, I don't know where, but I'm going to essentially free them up, and then your nerves will have space to heal. Easy job, your pain will go away. So on the 10th of November 2015, I went for my first operation. So I went for the left side tarsal tunnel release in November 2015. He said that the surgery was a success. What he did was he cut away the flexor retinaculum, which is what kind of compounds and packs those nerves into the alley that they're meant to be going down. He cut away a lot of scar tissue, he debrided the area. He did say it was an awful lot of scar tissue, likely from the running that I used to do or the sports that I used to play. But I didn't get any better. At the 6-week checkup, he said, oh, this is a long process. It could really take a long time for it to heal. At the 12-week checkup, kind of said the same thing, but he was concerned that it wasn't getting any better at all. And it just stayed that way. What he didn't mention was that during the surgery, he'd actually split one of the nerves, the lateral plantar nerve. So a nerve is meant to be like one nice wire. And if you cut a live wire, then it causes havoc. If you cut somebody's nerve that's meant to be intact and in shape, it causes havoc pain-wise. So that was not a good experience for my first operation. So after that, still kind of went down this route that it was likely tarsal tunnel syndrome that was causing me pain, that it was an issue with these nerves. So I looked into the reasons why these nerves aren't healing, why the surgery could have failed. So that's more things like the scar tissue could come back. He just didn't do a thorough job. And that there aren't an awful lot of things to it other than it just isn't tarsal tunnel syndrome. However, I went looking around, trying to find answers as to why it wouldn't work. And this took me to Dr. Baxter in Houston, Texas, who actually invented Baxter's nerve entrapment and therefore the surgery for it, which is essentially the entrapment of the calcaneal nerve, which is one of those nerves again, specifically the one that's responsible for heel pain. When I went to see him 9 months later, I went over to Texas. He looked at my feet, he took my history, he tapped on the sign again, he did his examinations, and he said, yeah, this is absolutely cut and dry tarsal tunnel syndrome, this. You have entrapped nerves, particularly and he said the reason that it wouldn't have worked in the last surgery is that he didn't release Baxter's nerve as the nerve that he's named after. So we went to Texas, we had this operation. I had it on both sides at the same time. He said it could also potentially be plantar fasciitis. What I'll do is I'll operate while I'm in there. I'll do the tarsal tunnel release and I'll make sure that I do a thorough job. He also operated on that split nerve. He sewed it back together essentially, which did cause a neuroma and further issues down the line. Probably a separate story. He cut away the plantar fascia in the hope that if that was causing irritation, that would allow it to heal again. He released Baxter's nerve on both sides. What else was there? There was something else, I'm sure. Anyway, he did a thorough job on both sides at the same time. He combined multiple operations in one, really, which I've got to say is a very difficult experience, to not be able to put your feet on the floor and fly back from Texas to the UK. I remember afterwards, he held on my 2-day post-op check. He held my foot in his hand, and in his deep southern accent, he was like, "You're gonna be fine, son." Which probably a memory that haunts me to this day, that the doctors are so brazen about this is definitely what it is, and this is definitely going to work, and you're going to be fine, and you're going to have your life back and stuff like that. But not to be. Again, a couple of months later, I still had the pain, and I know I had some pretty big operations in that one, so I did leave it quite a bit of time to recover. It wasn't getting any better at all. He checked in with me after a couple of months, and he said, well, yeah, this is quite concerning that you're not getting anywhere. And then after that, I went to check in with him, and I couldn't make contact with him again. Before I went over, there were rumours that he'd retired. When I went to see him, he's getting on a bit now. He coined Baxter's nerve entrapment in the 70s or 80s. But when I went to see him and I said, oh, a couple of doctors in the UK said you've retired, so you weren't approachable or anything like that. He said, no plans for retirement, nothing like that. But for me, he disappeared off into the sunset, never to be heard of again. I've tried contacting him loads of times. I've tried contacting the hospital that he works at. Just don't get anything back from any of them. It's mad, really. What I will give Dr. Baxter his dues for is that at the time my girlfriend had complex regional pain syndrome. She'd had a crush injury to the top of her foot and had completely mental amounts of pain in her foot. She was on crutches for years. The UK doctors said, well, we can't really figure out how to fix it, so hopefully you'll just wake up and it'll go away one day, which it was never going to do. They wouldn't operate on it, they wouldn't touch it. We found a peripheral nerve surgeon in the US who is widely regarded as the best nerve surgeon in the world. We had a consult with him, but we had a consult with him because when we went over to Texas, Dr. Baxter had actually looked at Mia's foot, determined which nerve it was that was injured, determined that the first operation that she had, which was the surgeon that I had for my first one that split my lateral plantar nerve, had actually removed the wrong nerve in a foot. It had removed a healthy nerve and not removed the injured nerve. Anyway, we go to Baltimore so she can have the correct nerve removed, which was a resounding success. So she went in the morning with this surgeon. I ended up going in the afternoon with him because his theory was that, well, you've had your tarsal tunnel released by the best in the business in Dr. Baxter. It's named after him. He's got to have done it better than anybody. He's done thousands in his career. So I'm not too keen on the thought of it being a failed surgery on his behalf. I'm more looking at this potential entrapment further up your leg. So he looked in the soleil sling, which is a little bit further up your calf, and again he found this extremely tender spot in my leg, which he said indicated quite severe entrapment in my calf. That entraps the tibial nerve, and then from the tibial nerve runs these nerves that go into your foot. So if it's being entrapped there, then it will cause issues downstream. So that was great. I then had a proximal tibial nerve release on both sides at the same time. Once again, so we had Mia from her operation, we had me operated on both sides, trying to get back from Baltimore at the same time. Both completely incapacitated. That was fun. Recovery wise, that was a much easier operation than any of the other ones, with it being my legs, not my feet, so I could get around much better. However, it didn't work. Even though, again, he opened it up, he said, oh yeah, I saw clear evidence that there was entrapment there, and I think this is the cause of your issue, and this entrapment puts pressure on the nerve, and over time that nerve then loses function because it's not being able to function at full capacity for a long time, that sort of thing. But yeah, it's clear now, you're all good, and I think this is really going to work. Another couple of months go by, the same thing happens again, or the same thing doesn't happen again, I guess. Nothing happens. After each operation, I don't get any better, I don't get any worse, it just goes back to exactly how it was, no change at all. So again, I'm speaking to the guy who's miraculously cured Mia's foot, because there really was no hope in hell for her at times. The best in the world. He says, but you do show clear signs of it being nerve entrapment. He's a peripheral nerve surgeon. To him, everything is going to be nerve-based. When you're a hammer, everything's a nail. When you're a surgeon, everything wants surgery. When you're a peripheral nerve surgeon, everything is the result of a peripheral nerve, that sort of thing. So he says, well, why don't we make sure every single box is checked? We did a diagnostic injection to my heels. So that was an anaesthetic injection, right so by where the scar that I showed you was before. And that significantly reduced my pain for about 6 hours. So for him, that was indicative that specifically this was the calcaneal nerve that was responsible. There is potential that I did have tarsal tunnel syndrome, but he says this diagnostic injection is really indicative that the calcaneal nerve is responsible, and it might have been from too much damage for it to sort of recover from. That's why healing wasn't really an option from before. It says, let's tick every single box under the sun. Let's do another tarsal tunnel release. In case of scar tissue, I'm going to wrap that tarsal tunnel in amniox wrapping, which is umbilical cord basically. So I've got umbilical cord wrapped around the nerves that are there now. So I'm going to do the tarsal tunnel release, I'm going to do a plantar fascia release, I'm going to wrap the tarsal tunnel in umbilical cord, and I'm also going to remove the calcaneal nerve on both sides. So that's the nerve that runs right down from the tarsal tunnel under your heel and kind of across your heel. That's the one that Baxter found to be to have entrapment. So we flew out to Baltimore again on my 21st birthday. I had the operation a couple of days later. So I had the calcaneal nerve removed on both sides, I had the tarsal tunnel release again on both sides with the umbilical cord wrapping, I had the plantar fascia release done on both sides. This was an absolutely huge operation, and to have both sides done at once when you can't put your foot on the floor for 6 weeks, he said, if I'm going to do both sides at once, then I want you to stay in Baltimore and in the area for 3 months, which I just wasn't able to do. I needed to be at home to recover. I couldn't have an awful lot of time off work. The expense of doing one side at a time, flying back, coming again, having more time off work, the trip itself, that sort of thing. So it took quite a lot of convincing for him to do both sides at once. He only did it because I'd proven it the year before when I went to Texas and again did both sides at once. Quite a recurring theme of me being stupid here maybe. A couple of months later, here we are again. No change to the pain, although this time I don't have a nerve in the heel. So why am I still getting heel pain? At this point, it's around late 2017. I dropped out of uni twice. I left another job because of, well, this one because of disability discrimination. Things weren't looking great. At this point, I was thinking, I'm going to have to amputate or live with this. I can't work out, I can't walk, I can't go and do my own shopping, I can't go to uni, I can't work at the time, or at least couldn't do the jobs that I was doing. What can I do? I've lost all my independence. I've lost any will to live, really. At the time, I felt like I had absolutely nothing to live for. I felt like I'd had it all taken away from me. So it's either amputate or live with it, and I certainly didn't want to live with it. But again, there's that question of, I don't really have a diagnosis because all the 2 diagnoses I've had so far have proven to not be true. And I've already had the nerve removed to the heel. I shouldn't have any pain in the heel. I am numb there, which is what removing a sensory nerve should do. But yeah, I'm still getting the pain. It's not changed at all. So I got myself back into a job that I could do, started getting back on my feet, if you pardon the pun, a little bit more. And I started going around to doctors and asking the serious question of, what else is there that I can do if I haven't already done it? And if not, can I amputate? And some of them laughed me out the door. They said, well, you can still walk for 10 minutes, can't you? You can still stand for a little bit. You can still do some things in your life. You've not crawled in here like a zombie, which is what one of them actually said. You've not come in a wheelchair. You're not screaming right in front of me in pain. Why on earth would you want to amputate? So that is the response I got from a lot of people, particularly from people who weren't doctors, who were told it was difficult for them to accept the possibility of me doing such a thing to myself. But it's a decision that I had to make. My main concern was that these diagnoses weren't right. The nerve is already gone, so I shouldn't have pain. So if I amputate, am I still just going to have that pain because I've still not got down to the root cause? So this is the question that's essentially plagued me for years. So I started working with a prosthetist with the amputation service up in Preston, and they were amazing. They answered every single question. They did every single test to make sure that I had covered every single box before I amputate. They found surgeons who were willing to do it. They also posed a lot of alternatives for me, such as the operation that I did end up having. Yeah, they were absolutely excellent, and for a long time I was ready to pull the trigger. Just never did. And it got to one day, and the prosthetist, I think he's actually a rehabilitation consultant. Essentially, his job for me was to think massively outside of the box and to try and coordinate things for me, because he's not necessarily a doctor himself, but he works with so many amazing doctors. So he'd done all of the assessments. He was like, right, you're ready for amputation. However, why don't we try, if we think it's nerve-based, and we're going to amputate to essentially remove all the nerves and the flesh, well, why don't you keep your own limb? Why don't we remove the tibial nerve, which is responsible for all of the parts of the hind foot of the lower leg, well, most of the lower leg, that sort of thing. So he, again, did a diagnostic injection, and he did it in the popliteal fossa, which is right at the back of the knee. And I said before that the diagnostic injection in my heel gave me pain relief for 6 hours. Well, this was absolute bliss. It was actually pain-free for the first time in, I think at that point, it was 6 or 7 years. So he only did it in one side, but for 8 to 12 hours, it was pure bliss. It was like, that is the reminder of what I'm doing this all for. That was one moment where I was pain-free, and that's been the only moment in this 10-year process. That also led to a lot of problems though. So the diagnostic injection, it goes to the tibial nerve, which is responsible for an awful lot of the leg's function. The nerves that go down into the tarsal tunnel that I mentioned at the start of the video, they branch off the tibial nerve. So he says, instead of losing your own feet, why don't we remove the tibial nerve? Because this injection has just proven that even though it might not be the calcaneal branch, it might be a different one, it might be all of them, it might be one of them, one of the responsible branches. If we take out the tibial nerve, you'll keep your foot. You will have some side effects, because it's essentially a soft amputation. You'll lose a lot of function. You'll kind of lose your brain's ability to recognise your foot, that kind of thing. But it beats having a prosthetic and putting that on every morning. His words, not mine. And I thought, well, why don't we give it a go? If I do that and I get too many side effects, then I can always do the full amputation. So I went around again, seeing all these surgeons that presented these things and said, well, too many side effects won't do it for you. And you're absolutely mental for wanting to do this. Which is easily said on the outside. They don't understand the pain that you're in. They don't understand the suffering that you're in. They don't understand all the things that you've had taken away from you. They don't understand the struggle. They just see a person who looks reasonably healthy on the outside. You could be risking a lot. You're stupid. However, for me, there is an awful lot that I'm willing to risk in order to get better. I'll never give up fighting. I'll never stop this pursuit of trying to get better. I don't accept that my life ends at 16. I don't now think that my life has ended as a result of it, but there have been so many times, especially in that first 5 years, where I really believed that. But yeah, I'm not going to sit and accept no for an answer. If I believe that there's a route for me to get better, then I will take it. So I found a surgeon who agreed that this was a way for me to avoid amputation, that it did almost the same thing as amputation. He said, I think that's a means to an end, removing the tibial nerve. I think it cuts out the messenger, so you shouldn't feel the pain, but I don't believe that it's like addressing the root cause, which I agreed with too. I know that amputating and removing the tibial nerve and stuff like that, they're not addressing the root cause. They are a means to an end because I've tried so much and never got a root cause. However, he said, I think I know what the root cause is. I think you are one of the very first people ever in history to have bone compartment syndrome. Now, compartment syndrome is fairly common in athletes for muscles, but I don't know if there are any or many cases of it in bone. He said, I believe that the pressure that comes from your bone marrow is what's essentially causing the pain in your calcaneus itself. So what I want to do is your next operation, before we remove the tibial nerve, is I want to drill a big corking hole through the middle of your heels. I want to biopsy the bone just to check this. But the removal of the bone should reduce the pressure, and therefore the pain should get much better, or at least that's the test. Even if it works a bit, then that kind of proves his point. So they say it's the hope that kills you. For me, it's kind of the opposite. It's the hopelessness that kills you. I've always struggled at times when I've not had hope and I've not had something else to try, basically. Not another step to take to think, oh, well, there's always something else that could get me better. And this was like a lightning rod. It was unbelievable for 8 years in for someone to say, I finally figured it out. It's dead rare. It makes sense. It's a pretty hefty surgery, but it's simple, and the side effects and the complications are fairly low. It was just, it was indescribable, really. So I went ahead with that operation. He did what I've just described. He went into the same place on my ankle that had been operated on a couple of times prior. But the biopsy came back a week or two after the surgery and said there's nothing wrong with your bone. The surgery healed just fine. The bone ended up filling back up reasonably quickly, to the point that when I had an MRI earlier in this year, they couldn't even tell that I ever had a huge chunk of bone removed. But again, here I am. He was wrong on that, I guess. It didn't work. So ahead we go to removing the tibial nerve. So that one with the heel bone, that was late 2021, and then early February 2022, that's when I went ahead with removing the tibial nerve. So I will show you some pictures of the scars that I've got and the wounds that I got from the operations themselves. I'll probably put them in a little slide at the end of the video rather than get my legs out, stuff like that. But yeah, remove the tibial nerve. It's a soft amputation. There are very few people that have ever done this. I've been warned not to do it by tons and tons of surgeons. But here's my chance of getting better, I guess. This is sort of the final nail in the coffin. If you've got no tibial nerve, I've said before, it's the main nerve in your lower leg that controls an awful lot of the function of your foot. all of the sensory nerves that lead to your heel, to your hind foot, to things around it. You remove all that. So the way that we took the calcaneal branch 5 years prior, that was one branch of the nerve. This is going, let's send an atomic bomb in, let's remove all of the branches. You will suffer motor-wise as a result, but this leaves no stone unturned. There is no innovation to the heel. There is no way, this is a law of science. If there's no nerve there, then you can't have that pain, or at least that's what the surgeons have said. A couple of months go by, it gets infected a couple of times, so it was a really difficult operation to recover from, by far the most painful that I've had. But again, here I am, no nerve, broken laws of science, and still exactly the same pain, not changed at all. That leads me to now, or recently, I guess. Enough doom and gloom about what hasn't worked. What am I doing about it? What are my options? I was working with that same surgeon for a while about whether we do the full amputation or not. And he said, yes, I'll amputate. It is your only option left. And then he ghosted me. So instead of chasing him up, I've been looking at alternatives. The only other alternative I've got is I was invited by the University of San Francisco to go for a clinical trial where they create a stimulator that goes into your brain, and it creates a personalized algorithm that essentially learns what your brain's doing when it's sending these pain messages, and then it tries to develop its own sort of machine learning algorithm to counteract that. So let's say if you did an fMRI on my brain, and when the pain goes bad, it lights up in the prefrontal cortex or something like that, or in the hypothalamus. It'll kind of do the opposite of that and hopefully turn it off. I prefer the idea of amputation over experimental brain surgery. Forgive me if you don't agree. I feel like not doing that is probably one of the most sensible decisions I've made so far. In the meantime, what I've been doing is working with an Ayurvedic doctor, working with a functional medicine practitioner, with a chiropractor, with an acupuncturist, with a dietitian, to kind of take this whole body holistic approach, because the more I think about it, the more I think I've had every operation that's possible with my heels, with my feet. There's nothing wrong with my feet, there's nothing wrong with my spine, there's no stuff like that. There's no physical condition for me to fix. I've had so many operations that I'm fairly likely to just get the same phantom limb pain if I was to amputate, but a foot off the end of my stump. So it's not really an option that I want to go for. I do, although I still may, out of sheer desperation. There are just too many unknowns about what's causing it. So I've been looking at functional medicine. I've been reading, I've studied functional medicine quite a bit over the past year. Studied Ayurvedic medicine, where they do this whole body approach, where a disease is only a symptom of your internal disease. So in my case, I have, which I'll cover in another video, because I have found to actually have some reasons for this pain. Let's say you can, as a person, you can only take so much stress, so many toxins, so many deficiencies, all of these things that build up and lead to disease. Whereas whatever symptoms you have, whatever actual condition you have, in Western medicine, all it is matching symptoms to a label. It doesn't really match the root cause. Whereas all functional medicine is worried about is we fix the root cause, we make you extremely well, we give your body no room for complaints, and whatever issues you've got, they'll heal right up. So that's what I'm doing at the minute. That's what my 6-month program is. I will explain what the functional medicine practitioner has found, how she has linked that to potential reasons for my pain, as well as some of the things that I mentioned before about the chiropractor. So I'm really quite excited about this, actually. If it doesn't work, then maybe I will go ahead with the amputation. I certainly do feel like this is the very last try. But I also certainly feel like I'm really onto something here. So fingers crossed, we'll see. that is my experience and history in operations and surgery and how I've got here and how I've avoided amputation so far. I appreciate it's been a long one. If you have any questions, whatever you want me to cover in the next one, please comment. Please share it with someone if they're struggling with chronic pain and can't get to the bottom of it. Hopefully this journey might help some other people. I have learned an awful lot along the way that I love sharing. And after this, I'll post some pictures of the scars and the wounds and things like that from operations. So if you like that, watch till the very end. If not, well, thank you, and I'll see you in a bit.